Welcome to the educational recording for Introduction to the Stopping Elderly Accidents, Deaths, and Injuries, also known as STEADI Initiative. This work is supported by the Nebraska Department of Health and Human Services Office of Rural Health Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of any funding source. I am Dawn Venema. Alongside my colleague Vicki Kennel, we lead the Catch Rural Falls program at the University of Nebraska Medical Center. We are both faculty in the College of Allied Health Professions. I am a physical therapist and I bring the clinical perspective of fall risk reduction to our team. Vicki is an industrial organizational psychologist, so she brings that unique viewpoint to our team, given her expertise in quality improvement, teamwork, and organizational science. The educational objective for this recording is to explain the purpose of the Center for Disease Control's Stopping Elderly Accidents, Deaths, and Injuries, or STEADI Initiative. STEADI stands for Stopping Elderly Accidents, Deaths, and Injuries. In 2012, the Centers for Disease Control launched this initiative. It gives healthcare professionals the tools and resources needed to integrate fall risk reduction into their clinical practice. It's intended especially for primary care providers who aren't necessarily specialists in geriatric issues because they have so many things to manage as a primary care provider. There's information about the initiative that is freely available online at the website listed on this slide. The information in STEADI is grounded in the American and British Geriatric Society's clinical practice guideline for fall prevention. Some features include a decision-making algorithm, patient and provider education materials, screening and assessment tools, and implementation strategies. In the Catch Rural Falls program, we would like to help rural health clinics integrate components of this well-established program. There's good evidence that it has utility in larger health systems, and while there isn't reason to believe it wouldn't work in smaller rural settings, it's possible that it may need some adaptations. There's a lot to the toolkit, which is why we are proposing to develop a complete program around it. This presentation is meant just to be a quick introduction. There are three main components of a clinical fall prevention program that are highlighted in the STEADI Initiative. The first is screening, second is assessment, and for third, intervention. Screening can be defined as the identification of patients at increased risk of falling to determine if additional in-depth assessment is needed. I want to emphasize that screening is defined to be quick, just getting a snapshot of the patient and whether or not they are at risk. Assessment is the identification of specific risk factors to guide intervention. For example, medications, problems with strength or balance, or orthostatic hypotension. The point is to take a deeper dive and assess for individual risk factors more closely to figure out why the patient's at risk for falling, and that is going to guide your intervention. Intervention, or the third step, is meant to address modifiable risk factors through medical management that you can take care of in your clinic or through referral to other healthcare providers. This is a screenshot of the full algorithm that is available on the STEADI website. I wanted to give you a visual of the complete algorithm, but I'm going to zoom in on sections that pertain to those three key actions on the next slides. Here you see the three actions highlighted by red boxes: screening, assessment, and intervention. Step one, that consists of screening, can be quite simple. STEADI suggests two options. There is a 12-item questionnaire available on the CDC website, or you may simply just ask three key questions. Do you feel unsteady? Are you worried about falling, or have you fallen in the past year? A certain score on the questionnaire, or yes to any of those three questions, is considered positive for fall risk. The results of screening is going to dictate the next steps. If the patient is not at risk, the STEADI components suggest some steps to take to keep patients that way, such as patient education about falls or referral to community-based exercise programs. If a patient does screen positive for risk, you go on to step two of the algorithm, which is assessment. Assessment goes on to recommend checking for various risk factors, such as medications, poor gait strength and balance, or orthostatic hypotension. And then what follows are interventions if any of those risk factors are determined to be areas of concern. Again, in the context of this brief recording, I'm not going to go into detail on these, but just to point out one example. You can assess medications for side effects that may increase fall risk, and then try to balance the risk-benefit ratio by stopping any medications that are unnecessary, switching to a drug with a lower risk profile, or adjusting the patient's dosage. The algorithm walks you through those specific risk factors that then guide the individual management and intervention of the patient. The STEADI Initiative materials available online provide additional information on how to assess and intervene in all of those areas. I wanted to highlight some published research about STEADI. Studies that have been published have been done mostly in urban settings, so again, its use might need to be adapted for application in rural areas. This is part of our motivation for the Catch Rural Falls program. This was a paper that described the implementation of STEADI into primary care in an academic health science setting, so a fairly large system compared to rural health clinics. Via team training, tools built into the EHR, and a tailored workflow, 75% of providers used STEADI tools. They screened about 2/3 of patients who were appropriate to screen. A side note is that they didn't include people that were already known to be at fall risk. There was no need to screen those people in those situations. 3/4 of the time, components of STEADI were used during routine office visits, so they were able to integrate its use into everyday visits, not just annual physicals. They were able to catch nearly 1/4 of patients who were at risk, and then of those at risk, 2/3 of them were assessed further at that same appointment and an intervention was initiated. For 1/3 of those patients, further assessment was deferred into a later appointment. So perhaps more time was needed than the provider had at that moment in time. So they were able to schedule a time for the patient to come back where that appointment could focus solely on fall risk. This is another paper that described actual outcomes using the STEADI toolkit. The data come from multiple primary care clinics in Broome County, New York. This isn't New York City, but it's certainly not a rural area. In this sample, they assessed fall-related emergency department visits and hospitalizations after implementation of the STEADI toolkit across this county in New York. Over 12,000 older adults had a primary care visit. 90% of those were screened. Now I'm going to focus those who were screened to be at risk. Those who had a fall plan of care established after being identified as being at risk were 40% less likely to have a hospitalization related to falls than those who were at risk but did not have a fall plan of care established. People who were identified as not being at risk were also less likely to be hospitalized and visit the emergency department than this comparison group. That is to be expected since they were not at risk. In summary, the CDC Stopping Elderly Accidents, Deaths, and Injuries Initiative was created to assist healthcare providers in primary care settings to address fall risk management of older adult patients. It's based on evidence-based practice guidelines for fall management and focuses on 3 main steps: screening to identify if a patient is at risk for falling, assessing to get to the bottom of why a patient is considered at risk, and then intervention to address risk factors that are found upon assessment. This slide provides links to components of the STEADI website and the 2 research papers that I highlighted in this presentation. And that concludes the recording on the introduction to STEADI. Thank you for listening.